My name is Dr. Samuel Kakraba. I'm an assistant professor at the Department of Biostatistics and Data Science at Celia Weatherhead School of Public Health and Tropical Medicine at Tulane University. So our dean has an initiative for artificial intelligence in the field of public health that Tulane should play a leading role in shaping the narrative and the conversation and also the field of public health using AI.
My goals for the school as it relates to AI is for us to be a leader in creating new knowledge and providing educational opportunities for students to use this new powerful technology. So there will be some students who will be involved in creation of new applications of AI, but I want others, all of our students, to be facile users of the technology.
My name is Paul Hutchinson. I'm faculty here in the School of Public Health. I've been at Tulane for approximately 23 years in the Department of International Health and Sustainable Development. I am the head of the Dean's Strategic Initiative on Artificial Intelligence and Data Science, which has been in practice now for approximately 2 years. I'm part of a team which includes myself and then several individuals in the Dean's office, Greta Kappelman and Tom Augustin, and Dr. Sam Kakraba in the Department of Biostatistics. The AI initiative in the school is, in my mind, really about building capacity. We have this new technology that clearly is having an impact in public health and will have an impact in public health for many years to come. And so we want to build capacity first and foremost in our students. So we want to make sure they have the most up-to-date information, build cutting-edge skills, and when they walk out of here after they graduate, being able to use this technology in productive ways that will contribute to population health and the larger field of public health. On the faculty side, we certainly want to build skills so that they can be good instructors in these methodological areas, but also to use these tools so that they can improve the content and quality of their courses. We know that we can use AI in many ways for instruction, as a tutor, as a means of developing course materials, many different ways, and this could certainly improve the quality of the instruction that we have. It can also improve the research that faculty do. And if faculty have the opportunity to practice with AI and machine learning, then they will become better instructors. And then the last area of capacity, we want to build our capacity as a school, as an institution, to be able to work with external partners. We like to say that we're on the front lines, but oftentimes we are supporting the organizations that are on the front lines. And so we want to make sure that we have the capacity to use AI and machine learning to help them, whether they're in clinics or programs in New Orleans East or community health workers in Nigeria.
There are many ways that we here are contributing to ensuring that those goals are realized. One of the first ways is through course development. To be able to meet the changing needs of artificial intelligence in the field of public health, in the biomedical sciences, our students are being taught, or we are developing courses that will be able to meet these needs, including applied machine learning. So not only do applied machine learning, applied artificial intelligence, applied big data and analytics, AI literacy courses, these courses are not only geared toward theoretical framework, but also to give students the practical hands-on experience to be able to use AI resources, develop their own AI programs that can be able to address real-life challenges in the field of public health.
We were also fortunate to receive a generous gift from the Weatherhead Foundation to provide a seed grant program for applications of AI.
Through the seed grant that we received from Celia Weatherhead, Tulane is able to call for collaborative grant projects between various schools in Tulane, various departments that are geared toward encouraging innovative research that focuses on the use of AI to address public health and biomedical challenges. This has offered students and faculty the opportunity to actually engage in meaningful researches that have yielded very great results. I will cite a few. For example, when it comes to diagnosing Alzheimer's, Parkinson's disease, we know the cost of these diagnoses is astronomical. It's so huge. Well, some of these seed grants have helped faculty like myself work with students on developing scalable AI workflows that actually help to identify less expensive biomarkers to assist in disease diagnosis. In the case of Alzheimer's disease, we've been able to show that we can use handwriting to assist with diagnosis of Alzheimer's disease. We've shown that in our AI workflows. Also, we've shown that we can use voice recording of patients to assist medical doctors to better diagnose patients who are most likely to be predisposed to Parkinson's disease than their counterparts. All of these hands-on projects, students are playing a key role in it and are really encouraging the use of AI in all of these research.
One of the most important things about the SEED grants is it is trying to partner established researchers in AI and machine learning with faculty and other students and organizations around the university who may not have as much experience. And so in this way we are having a diffusion of experience with AI and machine learning to build our research portfolio.
Also, we focus on symposiums, conferences, seminars. So just recently, we hosted a symposium here in Celia Weatherhead School of Public Health and Tropical Medicine at Tulane University titled Demystifying AI in Public Health. This brought together a lot of experts in the field of AI and public health and also involved students in changing and shaping the narrative in the field of AI when it comes to public health.
The symposium had three main purposes. The first was raising awareness about the use of AI and machine learning. That was embedded in the title of the symposium, Demystifying AI in Public Health. So we brought in speakers from outside, we brought in internal researchers, we brought in students, and they all talked about their work. And then after their presentations, we talked about the issues that have been raised. Things about algorithmic bias, fairness, equity.
Students had the opportunity to present some of their cool projects they are doing in using AI to address challenges in public health across various spaces. Some were using AI to address issues about how do we predict lung cancer ahead of time, using medical images. Some were looking into kidney failures, heart diseases, and many other very important public health concerns that they were using AI-focused approach to help identify and to address.
Another purpose was simply to raise awareness both within Tulane and outside of Tulane of our capacity to do work in this area, to do research. And that brings us to the third main point, which is simply to provide an opportunity for Tulane researchers to interact with people in New Orleans who are also working in this area and academicians from outside of Tulane who are also working in this area. So the idea being to provide a forum for discussion and reflection on some of these topical areas.
I think there are many potential applications, and the symposium, I think, brought out a lot of those potential applications. And we're also looking at potentially creating certificate programs so that we can train people and provide certification in the use of AI within public health.
So we had this initial investment from the Weatherhead Foundation, which has allowed us to do a number of activities, the research symposium, the SEED grant program, and we're hoping that this is really just the start of some of these ideas. So the research symposium, this was the first annual, and I say annual because we're hoping that there will be a second annual. The SEED grant program, we're hoping we can continue to expand. We hope that this will be a successful year, leading to larger external grants. And then we can continue to do it as we bring in new students and new faculty and new researchers.
As you know, we were the first school of public health established in the United States. We were also the first school of public health to establish online programs. It's critical that we continue our tradition of leadership, and I think that we would also want to apply that to AI. We want to be considered a leader in the application of this technology to solving public health problems.